Hello, I'm Judy Sedgman. Welcome to another edition of Innate Health, eliminating stress and creating healthier communities. We're continuing in this segment with our discussion of PTSD with our colleague, Dr. Bill Pettit, who comes to us from Michigan and is a longstanding colleague and friend of mine and a person who has represented this innate health work, especially in the field of medicine for about 30 years at least, and has had a huge impact on many, many patients. And as an illustration of that, we're very pleased to have with us today Marie Citrangelo, who is the mother of one of Bill's former patients. And this is a very touching story, and I want to start the story by reading you a letter that Marie's daughter, Nicole, wrote to Dr. Pettit after a while, after she'd had some experience with innate health. To whom this may concern, my name is Nicole Citrangelo. I graduated college in December of 1994 with 2 BS degrees. About 3 months later, I was brutally assaulted and nearly murdered by someone that I knew in college and who had become a Massachusetts state trooper. The assault lasted over 8 hours, in which I was beaten unconscious nearly to death, kicked, punched, and tortured, all while locked and loaded semi-automatic 9mm gun was being held to my head. At one point, the person put the gun in his mouth and tried to make me pull the trigger. I was also raped while the gun was held to my head. This high-profile case made national news. Before this incident, I had no psychological issues and had never seen a mental health professional for anything. Immediately after this brutal attack, my mind slipped into what was diagnosed as acute and severe PTSD. It took days, weeks, and months to remember most of the events that took place. Over the next 9 years, I was hospitalized many times in mental wards. These hospitalizations were too many to count. I can estimate there were more than 20, some lasting in excess of 3 weeks. Over the years, I was prescribed in excess of 40 different psychiatric medications, often taking 10 or more of these a day. I was extremely suicidal and made numerous attempts to take my life. One of those attempts resulted in me being in a coma for a week and the doctor saying there was no medical explanation why I lived. For many years, I wished I had died that horrible night that I thought had changed my life forever. In 2002, a doctor wrote a letter indicating that I was permanently damaged and would most likely never be able to function on my own again. After hearing this prognosis, I felt doomed, and I began drowning my feelings of hopelessness with alcohol and drugs. During one of the ensuing hospitalizations in April of 2003, the psychiatric team considered having me committed to a long-term facility because of my determination to end my life. Subsequently, I was hospitalized an additional 4 times at Chestnut Ridge Hospital, which is at West Virginia University Medical Center, the last of these being in July of 2004.
Sorry. I'm sorry.
That's all right. One afternoon during this hospitalization, I was standing at the nurse's counter saying to the staff how I was stuck in this mental state of feeling forever doomed and how I did not want to live anymore. A doctor whom I had never met was standing at the far end of the counter and overheard my comments. At some point, the doctor interjected and said these feelings were due to my thinking. My first thoughts were that he had no idea what he was talking about because he didn't know me nor what had happened to me, and that I was an exception to what he was saying, and I said just that. He responded by elaborating a little on his previous statement. At that time, I got a glimpse of a light that I now see all the time. He later dropped off books on the 3 Principles by Sydney Banks. After watching several videos of Mr. Banks, my life completely changed. A few years prior, while hospitalized, a video had been played for a group. I got it immediately, but it didn't last. I asked the staff who the video was of, and no one knew. I could not find any information on it. It wasn't until years later that I realized who it was after Dr. Pettit gave me some more videos to watch. It didn't take long for me to realize that there might be a way out of the state of mind that I had been unknowingly feeding for so many years and had resigned myself to. The only way out that I had ever previously known were suicide, alcohol and drugs, and praying daily for God to take me back. When I met this doctor, Dr. Pettit, I was on 300 milligrams of Zoloft daily, 200 milligrams of Trazodone at night, 1 milligram of Klonopin 3 times a day, and Ativan is needed for flashbacks. I usually took it daily. During the previous 9 years, my longest period of time in between hospital stays was no more than a few months. The day I met Dr. Pettit was the last day I was in a mental hospital, some 4+ years ago, and no longer needed the medications. I began to see that there was a different way to perceive my thoughts. This enabled me to see I also had control over my future. This was something I always had deep inside of me, but completely lost touch with as a result of the trauma. It was not about the thoughts I was having as much as it was what I chose to do with them. I might add that I'd been a patient of a number of doctors who are currently considered to be the best mental health professionals in the country. I have not been hospitalized in well over 3 years. I no longer consider suicide an option or would even want to die. All of my perspectives have changed. I'm mentally healthier now than I have ever been. These simple concepts have allowed me to change myself and my way of thinking. I'm now doing things that I never thought possible. I've recently been presented with life challenges unlike any I'd experienced before, and I am better equipped now than I ever would have been, even prior to the trauma, had I not learned this way of thinking. I only have one wish, that being that all people struggling with any form of mental illness could learn of these principles and apply them to their own lives. If I was introduced to these principles before I was traumatized, I could have avoided many hospitalizations, self-labeling, suicide attempts, and all of the grave and grim prognoses by the dozens of doctors I saw. Understanding these principles saved my life. They saved me from myself and my thinking. I would suggest these principles not only for the so-called mentally ill, but for all humans in the world in order to better their lives and their world. I know I would not be here today without that chance meeting at the counter during my last hospital stay more than 3 years ago. I can't say enough about this and the great potential it has to change so many more lives if it were learned and accepted around the world. The great thing about it is not only how easy it is, but also that nobody has anything to lose by simply opening their mind and learning about these principles. I'm so grateful for meeting Dr. Pettit and being introduced to Sydney Banks' principles. It has allowed me to live again and enjoy living. Most sincerely, Nicole Citrangelo.
Well.
So, with that, maybe you could talk a little bit about how this story evolved.
It kind of, certainly brought me back to that moment, being with Marie's daughter, Nicole. I saw this lovely young woman who was obviously very pained. And I think, as my recall was, that I actually was a little more intrusive than Nicole was kind to me, because I usually am very, I think, sensitive to people. But I suddenly found myself saying, as she was asking why couldn't she just be allowed to die, I did suddenly said something with no introduction, that whatever it was that she wanted to die over was over. That it didn't exist anymore except as a thought. And we did have further exchange, which then I might have mentioned, I guess, that I did do groups, and then I would be able to, and I don't even remember saying that. I wonder if the nurses, but I did hear later that after I left the unit that Nicole said to the nurse, how do I get to see that man when I get out of the hospital? And, you know, I think she had 22 or 23 hospitalizations.
At the very least.
At the very least. And, you know, the reason that people might be wondering why Nicole isn't here with us today telling the story is that very sadly, she did very well, and I'll let her mother talk about that. She and her mother moved down here to the Tampa area, and while riding with a friend, she was struck by an intoxicated driver and was killed. And so there's, you know, certainly a sad ending to the story, and yet at the same time, you know, her mother and Nicole had expressed often the gratitude that she had for the time in her life that she was no longer in pain. And I'm wondering if maybe it'd be good to have Marie talk about that, you know.
Yeah, Marie, could you tell us, you know, what you saw changing in Nicole, and then tell us a little bit, whatever you'd like to say.
First, I'd like to introduce my daughter, Nicole Marie. Nicole Marie Citrangelo. She, that's her college graduation picture.
Wow.
Taken in 1994. And April of 94, in March of 95, she was kidnapped. It was not a very pleasant thing at all, very brutal. I know that I had totally lost my daughter to drugs, to alcohol, to any way that she could hasten her death. She would put herself into many, many life-threatening situations, many, and the hopes that she would be killed.
Wow.
And I would pray nightly that, Lord, if this is the night you're going to take my daughter, please don't let her suffer. Make it very quick. And please let me know so I don't wonder forever.
Wow.
He answered both of those prayers. But that's how bad it was, how I never knew when she walked out the door if I'd see her alive again. I do know when she met Dr. Pettit, because she told me, she says, Mom, she says, I think I've met someone that might be able to help me. She said he asked me to just come to one of his classes, and I could leave in the middle of it if I wanted. I could go to sleep if I wanted. He didn't care, just come to one and make a decision after that. And she did go to the class and came home very, very excited. She says, Mom, I think it's the real deal. She said, Mom, I think this guy can help me. She says, he told me not to keep going over everything that happened to me, to think about other things when those thoughts come in my mind, to go to a better place. And I saw my daughter she became herself again. It was like a rebirth. Not every parent gets to see that in their child. I was very fortunate to have. And when Nicole died, she had a very firm understanding of the three principles and wanted to share them with anybody and everybody because she knew they worked. No doubt about it. And she, being a non-professional counselor, practicing without a license, would counsel anybody and everybody that would listen.
Yeah.
Whether it was some guy on a bar stool next to her, somebody at a dog park, anybody who needed it, she would tell them about the three principles, tell them that they had it within them to recover, but first they had to quiet their mind from these other things. After she recovered, we chose to move here to Florida to retire, for me to retire, but to be together. And I think she said one thing to you, that the only thing she regretted about coming here was she would have nobody here that understood the three principles with which to communicate and talk and that understood them. And you said, but there is.
Yeah.
And then she became very excited to come down and be part of it.
Yes.
And part of it she was, and she was just a dynamic individual.
You know, that's something I wanted to say, Marie. I had the good fortune of meeting Nicole on several occasions in West Virginia. And one of the things that always struck me was how generous she was in sharing her story if she thought it would help. Many times in group, I would sit and listen to her tell other people, don't be discouraged, everything's going to be fine, change is coming. You know, look what happened to me. If I can change, anybody can change. And she was such a beautiful, generous spirit.
And I don't do public speaking at all, but if me speaking about her recovery can give one person hope and help one person, that's all it's about.
Yeah.
To me, it's honoring her memory.
Well,
That's beautiful.
I know that you guys probably don't know how she grew up, but she grew up a pretty normal, standard life in a small town where if somebody cut their finger, someone else across town would bring a Band-Aid. And she graduated with 2 degrees. She was quite an artist. She entered into exhibits, photography. She was gearing up to enter some of her pastels. She was planning on going back to college to study law at Suffolk University. Everything she did was to benefit somebody, to help somebody.
she had a huge heart.
She did.
She really did. And
Yeah.
and that heart had always been there. It just that for a while, for those 9 years, she was in survival.
Yeah.
And she was so pained.
I used to say to her, but Nicole, you've survived. And she'd say, no, Mom, I'm surviving.
Yeah.
I'm surviving 1 minute
At
to
a
the
time.
next, Mom. She says, I'm just surviving.
Right.
And afterwards, she would say, now I'm living.
Now I'm living.
Yeah.
She was thriving.
She was
Yeah,
thriving.
yeah.
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 And
So, as I read her letter, I was struck by 2 things, Bill. One is that although she expresses great gratitude to you, she doesn't, and I've noticed this across the board with your patients, truthfully,
Right,
is that
right.
they don't give you a lot of credit.
Right, which is wonderful.
Which is wonderful.
Right. They know it's not me.
It's an unusual, I think that's
Yeah.
something to talk about here,
Right.
that people see right away that it's in them.
Right.
And they wake up to something inside themselves that's so thrilling for them and so exciting that
Right.
it's kind of like, oh well, I think of that Molly that
Right.
Yeah,
she said
you
he
might
didn't
tell
do
that.
he didn't do that much.
Yeah.
Right. Molly was I said very
Yeah,
briefly.
tell
Molly
that
was a
story.
young woman who Marie, who I actually saw in the hospital at the same ward. And I was on call one weekend, a holiday
Very
weekend,
similar
long
story.
4-day weekend. And this was her 5th hospitalization in 7 months. And she was in a psychotic state, which, some people will say, well, maybe PTSD, but what about, this lady was in a psychotic state, and she, gibberish, whenever she talked, she was about 26 years old. Every time she started to talk, gibberish came out. It made no sense.
been there.
Okay, so she was in an incredible manic state, 5th hospitalization in 7 months. And at one point, I listened to her, and then I said to her, I said, Molly, I'm going to say something. I'm just going to ask you to listen as quietly as you can. And she got quiet, and I said, I want you to know that you are perfectly mentally healthy. You just don't know it. And that you have somehow, and I don't know the details, you've gotten caught up in a lot of painful thinking. And as you've gotten caught up in that painful thinking, it has dysregulated your physiology, even your neurotransmitters in your brain. And what we're finding out now, that after 30 minutes of doing that, it literally started turning genes on that shouldn't be turned on and turning other genes off that shouldn't be turned off, such that now you're manifesting this inability to even speak to make sense. And so we get our little book out and we label you and tell you that's who you are. And I said, that's not who you are. You're perfectly mentally healthy. Well, about 6 months later, or 8 months later, when she's now in nursing school, fast tracking to become an RN, and she's now a wonderful neurological nurse on a neurology service at the university. And we've got, this is at Grand Rounds, and she's sitting here, right? And the students and all the residents and the chief of psychiatry and
Yeah.
and people said, well, something about it. And at one point she said, well, Dr. Pettit didn't do that much. She said, he just pointed me towards these principles. That's really what's helped me, which is true, right?
Yeah.
But somebody asked her, they said, what did you think when Dr. Pettit told you, when you're sitting there unable on 800 milligrams of Seroquel and 1,200 milligrams of lithium, unable to even put a sentence together, and he told you that you were perfectly mentally healthy? What did you think? And she's really cute, isn't she? She's really
yeah.
cute.
It's funny.
I mean, Nicole was elegant and cute. She's more cute. She's just cute.
Yeah,
And
yeah.
she said, well, the first thought I had was, oh my God, they've given me a psychiatrist that's crazier than I am. And of course, that was coming from her personal mind.
Right.
And then she said, right after that, another thought came up, which we would say is from this first principle of mind that we're all connected to. She said, another thought came into my consciousness that said, you know, that's true. What he just said is true. What he just said is true. Mm-hmm. And that's that mind, the mind, thought, and consciousness, these three principles that we're not only using, but we are a manifestation of, that we are all a manifestation of, I'm going to say, divine energy, of whatever that energy was that was there before the Big Bang. We're all connected to that energy, and we are that energy, and we're using that energy to create our experience moment to moment. And she started to get a glimpse of that, just like Nicole did. And I think of two things that come to mind. Would it be okay to share them?
Yeah, certainly.
Is this an okay time?
Yes, yeah.
One was a patient of my wife's, who's also a therapist. When she first, I won't go into the details, but when we first, she was widowed also, and I was widowed, and we married, and at first she didn't want to hear it. She said, I love you, but I don't want to hear about these principles. Right? So for 2 years, I said, okay, no problem. And something happened that she said, you know, I want to learn more about these principles. I see that you know something that I don't know, and I think she'd be okay, because she said that, and I'd like to learn it. And so she really went into it and learned about, read the books, watched the videos that Nicole did.
Came to trainings.
Came to trainings, and now she's just a wonderful, beautiful teacher of these, and powerful teacher. I mean, I turn, when it comes to talking about the principles, I turn it over to my wife, because I think she speaks about the formless and about the spiritual nature of man and us in a way that is just so beautiful and so easy for people to hear. But when she said, now I have to take this back and I have to see if it really works with patients. And she went back to a practice that she'd worked with years later. And every patient, she started doing a Beck depression inventory and a Beck and anxiety every time they came. And she would come to me amazed that over 75% of the time, within 3 sessions, those scores had dropped to over 50%, and sometimes much more. Mm-hmm. And I remember one of the first times that she had somebody who acutely had been traumatized with a rape. And this young woman, 20 years old, was in shock. And as you were talking about Nicole's, I thought she could have gone through 9 years and 23 hospitalizations had somebody done what they did in Nicole, take her back into it, talk about it. My wife asked her to tell the story once. She said, I need to have you tell me the story once, because if it ever gets subpoenaed or anything, I have to be your advocate. But after that, you will never have to mention this story again. The young woman said, really? She said, yes, never. She said, I have some, and even the first session, she started teaching her, and she gave her the missing link. And well, the young woman came back the third time for her third visit and said, you know, I didn't need to come back today, but I came back to thank you. And she said, if if what happened had to happen for me to learn this at this young age, a very small price to pay. Whoa. That's not what most people in the field would say. And she said, I'm just very grateful. And if I ever need your help, or I will call you, but I think I'm going to be fine. Right? I'm fine. In fact, I feel much better than I did before this happened.
Yeah.
And I feel armed with an understanding that's going to help me through all the challenges that life is going to face with. So very quickly, the cute side of the story is the mother came into the office right after the young woman went out, and she said, can I get some names of some other books for my daughter to read? And my wife said, well, she seems fine. I'd be glad to give them to you. I think I've already She said, well, really, they're for me because I want what she's got.
Yeah.
Right?
Yeah. We've seen that happen so many times.
So many times.
Yeah. I do, as I mentioned before in these sessions, I do a group of 4 women as a volunteer, and they've started bringing friends, and it's so sweet because just the other week this girl came in that I hadn't seen for quite a long time. She came to a series and then she went off and did her life, and she came in, she was all bouncy and happy, and she had sent a friend, and she said, I just came to check up and make sure she came. And I wanted to be sure she was here because I told her she must come to this group. She said, I can't explain this to you, but she can, and you need this. And it was so sweet because the other people in the group who was starting a new series, and they're looking at her, and one of them said to her, well, what were you like before? And she got all droopy. She's a real dramatic little girl. She got all droopy and made this really sad face. And she said, I was like this, and I wouldn't even look at you in the eye. Wow. It was amazing.
Wow.
Yeah.
There is 1 or 2 things that I'd love to say and at least point. I mean, I know our time is limited. Do you have some sense? 5 minutes, 10 minutes?
7.
7. So, you know, that the people that have, we've talked about people experiencing something. One of the things, and it's been kind of, and I won't go into detail, but it's a whole nother time if I come to visit sometime, the dead horse in the room in the war soldiers with PTSD has been not only what's happened to them and people around them, it's things that in the craziness of war that they've been ordered to do or have done, with or without orders. And the answer to those things, to me, is not psychological, it is spiritual. It is understanding a connection to every other human being. It is understanding a concept that is hard. It's like a whole turkey. I'd ask people to just take whatever bite of it they can. What I'll call psychological innocence. And understanding these principles of mind, consciousness, and thought allows the people to see that every single human being, every moment, is doing the best they know how to do. That moment, given their level of understanding and their state of mind at that time. I have worked with, with soldiers from Vietnam who had been ordered to kill young people repeatedly because they might tell where the forces are, and live with those nightmares every night. And I had one man that after 45 years, he said, and he started to learn the principles. He said, I think I'm finally ready to forgive myself. That I was doing in the craziness of war the best I knew to do. And forgiveness of self and forgiveness of others. I tell people there's no should. I would never tell people you should. But if you want to be at peace, you want to at least be open to the possibility to see that nobody has ever harmed another human being when they themselves were full of peace and joy. That only a person in pain inflicts pain. And we all in our own lives, in some version, have done that. We've never done that in one of our top 5 days of our life.
Yeah.
Right?
No.
And so those are loaded things, but forgiveness of self and forgiveness of others, and being open to the possibility, even if you don't see how you could, I've never seen anybody truly find peace without that, without seeing their own innocence and the ignorance and the innocence of others. So.
Yeah, and I think that's a subject that needs to be addressed, but it's hard for people because they feel so often when you talk about forgiveness or just even being able to understand that a perpetrator or a person who is involved in a situation beyond their imagining was doing the best they can. That's difficult. I think it's hard for people.
It's hard, and it sometimes feels like you're condoning,
Yeah.
and you absolutely are not condoning that or making yourself vulnerable. But without forgiveness, people live in. I mean, Mr. Banks says it very eloquently in 2 or 3. The unforgiving mind lives in a prison. The day that I forgave people for things that had done to me was the day that I was let out of the emotional prison of my own thinking, and you know, I felt remiss if I would not have mentioned that. You know.
You know, Marie, as we're coming to the end of the program, I'd love for you to talk about the last years that you had with some of the things that you and Nicole did together. That, you know, how her enjoying life again took shape and
We did a lot of things together. I taught her to ride horses. She loved that. She got into photography as a hobby, and she was quite gifted there. She she always loved athletics, but she also got into artwork.
Yeah.
She really wanted to help people. She got out. In fact, there's a line in here. Dr. William Pettit introduced Nicole to the principles of mind, consciousness, and thought by Sydney Banks. Nicole dedicated her life to spreading these principles to mental health professionals, speaking to inmates at correctional facilities and offering counsel to anyone suffering from trauma in an effort to make a difference and help people change their lives for the better. She was in the final stages of authoring a book on the shattered soul and picking up the pieces. And I would like to get that published someday. I just don't know how to go about it.
Well,
but our life was very good. We bought a home here in Florida, moved from West Virginia. We're just getting settled in. Wonderful, enjoying a few afternoons at the beach all the time.
Yeah.
Life was good.
Yes.
And I miss it.
I'm sure you do. But what a wonderful gift to have those memories.
To have those days back, oh my.
Yes.
It's just, I still thank God every day for that.
Yes.
I still thank God. I'm just incredibly, incredibly proud that Nicole Marie is my daughter and always will be.
That's a beautiful, beautiful thought. And I'd like to say she was an incredibly beautiful soul and a wonderful person. You know, we feel very privileged to have known her as well.
Me too.
And I know there were many people among your patients and colleagues in West Virginia who felt that way.
Yes.
She may have been attractive outside, but she was
Beautiful.
drop dead gorgeous inside.
Yes, yes, through and through. Well, sadly, we've come to the end of the program. And I want to thank you all for joining us on this series, Innate Health. And I particularly want to thank Dr. Pettit. Your openness and your straightforwardness and your willingness to talk from the heart is a hallmark of your compassion and goodness as a psychiatrist, but also of the joy and humanity that people seem to discover as they get deeply ingrained and engrossed in the principles. And Marie, I know that that you've come a distance, and it's wonderful that you joined us, and thank you for sharing your memories of Nicole. And I certainly would dedicate this program to her memory, to a beautiful soul who I hope that what we shared of her today will help a lot of people who might see this program around the world. So thank you very much, and we'll look forward to seeing you on the next edition.